Have you ever wondered how the voluntary control of eye movements occurs? Do you know which part of the brain controls this? Have you ever wondered how it is that you can smoothly pursue a moving target? I'm Richard Serafian, and I'm here to explore with you the cerebral hemisphere and its role in the voluntary control of eye movements. The eye position and movements are controlled directly by 6 extraocular muscles: the superior rectus, the inferior rectus, the medial rectus, the lateral rectus, the inferior oblique, and the superior oblique. These 6 muscles are controlled by neurons projected from 3 nuclei located in different parts of the brain stem. Beyond this, the neural circuit that controls eye movements are complex and controlled by many different systems in the brain. Without the frontal cortex, the cortical structures of the saccadic system include the frontal eye field, or the FEF, the supplemental eye field, or the SEF, and the dorsolateral prefrontal cortex. Command for voluntary eye movements arise from these specific cortical areas in the frontal and parietal lobes. The FEF is the area that is involved in the preparation and triggering of all saccades and in smooth pursuit movements. Saccadic eye movements are rapid ballistic movements that abruptly change focus. Saccades can be elicited voluntarily, but generally occur reflexively when the eyes are open. On the other hand, smooth pursuit movements are much slower, tracking movements of the eyes designed to keep a moving stimulus on the fovea. These movements are under voluntary control. Impairment in smooth pursuit eye movements will typically result in saccadic tracking. Localizing the site of disease in patients who have defective smooth pursuit movements is difficult, as any lesion anywhere in the pathway can lead to such findings. The presence of nystagmus during attempted visual fixation of a stationary target is abnormal. If the slow phase velocity or intensity of such nystagmus is similar both during fixation and when fixation is prevented, then a disorder of the fixation system is inferred. If slow phase velocity is reduced during attempted fixation, then the fixation system is at least partially functioning and another oculomotor disorder is present. Unilateral cerebral lesions result in a directional pursuit deficit, in which horizontal pursuit directed toward the side of the lesion is impaired. This unidirectional deficit may occur with lesions affecting posterior cortical areas or the medial superior temporal visual area. It could also occur following lesions of the frontal lobes that involve the FEF or the SEF. There is significant evidence that schizophrenic patients exhibit deficiency in smooth pursuit movements. This is thought to be related to less activation to the frontal eye field and a greater activity of the hippocampus, resulting in the inability to inhibit the saccadic system. Autism and patients with post-traumatic stress disorder have also been shown to have deficits in smooth pursuit movements. Lastly, alcohol and other psychotropic drugs can significantly affect the control of eye movements. These have been summarized here in this table. Alcohol in particular, though, has been shown to have diverse effects, including reduction of velocity, increased saccadic latency, impairment of convergence, and induction of nystagmus. One of many reasons why driving intoxicated is a bad idea. So there we have it. A complex neural circuit that controls voluntary eye movements, allowing smooth pursuit movements that can be affected by a number of neurological conditions and pharmacological agents. How amazing is that?